First of all, I would like to congratulate and thank Dr. Pilar Muñoz Calero for doing all this work for some time alone. In Spain, we love to criticize people without doing anything. Critics don't do anything, of course. So I think it's necessary to be fair and state that we are very happy to have collaborated, to have contributed in a small way to the development of your project, the project that you've been working on for years. It is also a reason for satisfaction to be here with very prestigious international researchers. During my presentation, I will try to describe integrative medicine and also present a few cases, particularly with a focus on integrative medicine and its model, a non-linear method of analysis. We are young, we are very eager to save humankind, and after the residency at the hospitals, well, many of those want to be working in the field of plastic surgery. In the past, they were more interested in being cardiologists, etc. So there are changes also in regard to the preference of the young doctors. Our teachers, our professors, whom we respected and admired, taught us the principles that have been validated by scientific communities, that have been supported by the pharmaceutical industry. They do their work, and the establishment, the legal side, ratifies these principles. Thus, getting out of this way of thinking, of this model of thinking, is difficult. So one day, one might look at the mirror and say, what have I been doing up until now? How will things change? How can things change? Because when one starts thinking that way, one becomes a pariah, someone that will not feel comfortable anywhere because of the cultural differences. What does one do with his or her colleagues? They'll think that he's gone mad. That's the dark side that has possessed him, or perhaps they just laugh at him. So this transition is rather complicated and difficult, and one must recognize that. Integrative medicine. Well, each time I speak about integrative medicine, people tell me that's a bad term. But the one who developed that called it integrative medicine from the private sector of medicine of the United States. As Don Quixote said while he was speaking to Sancho Panza, he said, language does not fall within the domain of academy. It belongs to the people. Here we have a figure, a person. Those of us who do integrative medicine, well, we like to say this is a new type of medicine. You see, because it has this additional value, an added value. It appears to be that we're going to do something better. That's why we like to say it's a new approach, new medical approach. This is nothing new. It has only been adapted to the 20th and 21st centuries. It is a way of thinking. it is a way of proceeding that dates back so many years in the past. I hope I can manage this computer without causing a lot of trouble. So integrative medicine, in fact, is a new, old way of practicing medicine. And it arises from a fusion of Western medicine, scientific and technologically based medicine, evidence-based medicine, therapeutic tools that have existed to date. This is what happens. Yes, my daughter, who's studying nursing, really controls the computer, and she did that slide for me. So Western medicine moves towards the alternative complementary medical practices. It's the Western medicine that moves to that realm. Professor Rosenberg in 1993 and 1997 published two studies that showed that 34% of patients used natural resources and they did not inform their doctors. Private medicine in the US could not allow losing this part of the cake. So integrative medicine arises from that point on. But its focus was really, and its objective was economy based. Economy based. In 97, Rosenberg conducted another study, and the number of patients that used techniques, alternative techniques, or complementary techniques or products increased. I don't like to use the term complementary because it downgrades this alternative. Alternative to what, one might ask? Complementary to what, one might ask? Because that can arise, of course. What is created are units of complementary medicine. I think this is increasing in Spain. In the oncology units, there are complementary units, the so-called soft techniques, and it gives one this impression that it completes the procedures and processes of the oncology unit. So the doctors who were disappointed in the results switched to integrative medicine. Revisionism in the past had not been successful. Little economic gain was achieved, and the doctors, the so-called alternative doctors, rebelled. And they had this emotional tension. They could not understand the other doctors and could not understand what they were doing, and they were criticized. So that's a different culture. This is a culture that is based on what has been established, a culture based on evidence, and those who were focusing on new approaches became stigmatized. They were considered to base their thinking on intuition. They were not well received when they submitted their studies for peer review in the journals, and their papers were systematically rejected for publication. Those who had seen a possibility of economic investments with profits, since returns did not appear so quickly, they stopped providing funds for investment. So this attempt had failed. They did not have time, they were not given time to develop.
No es una nueva especialidad.
This is not a new specialty either.
Nuestros compañeros de medicina general,
When our colleagues, the GPs, of family medicine, internal medicine, and know that this is not a new specialty. It is medicine elaborated for everyone, by everyone. Environmental medicine requires super specialists. That will be the reference point. Knowledge of the toxins, their impact on humans. If that is not offered to everyone, if that is not done for everyone, it will fail. And I believe that in the forthcoming years, blood toxins will be determined, as we do now with determination of cholesterol values. If we do not do that, then everything will be senseless. It is going to be another additional etiological agent, presence of toxin in blood, and that will be a part of the analytical workup. We have the development of rationalism that attempts to overcome the excess of reductionism. Medical education, medical training was developed from that model. Pedro Conte, president of the Spanish Society of Internal Medicine, said that doctors leave the medical faculties now being more sure about questions than being that part of humanism for the patients. It's necessary to provide solutions to emergency settings, solutions for surgery, solutions for this or that, but they fail in regard to the management of the chronic cases. And they have to cope with new phenomena, social phenomena, such as the aging of the population. Here's the pyramid for the Spanish population. And the chronification of the diseases observed in 2020. What we have right now, we have more people in the 80 years group than for the group under 15, and that's what we're going to have. That population. No, I need your help here now.
¿Y la luz? ¿Y la luz cuál es? Aquí, ¿no?
El verde.
¿El verde? Sí. Este de aquí. Aquí. Vale, gracias. No te vayas muy lejos.
Don't go too far away. Yes, I really don't know what we'll be able to do without you. Well, observe here again, once again. Baby boom and baby boomers. And baby boomers represent a generation, a privileged generation. In the US, they were born after the Second World War. The baby boomers in Spain are a bit later. This is a generation of Mick Jagger, and when they say retire, they always say, why should I retire? I was the one involved in the sexual revolution. I do not have to cope with any wars like their grandparents and the parents before them, the First and Second World Wars. The baby boomers, the baby boomer is the king of mambo, king of tango, and they're not going to say right now, they think that, well, I should retire. No, the baby boomers have the Mick Jagger mentality. They won't retire. They have created this new movement, the movement for anti-aging, the anti-aging movement, and they're pressing for cultural changes in medicine. The patients make doctors change. The doctors don't start change. It is the patient that makes doctors change. 22 million people in Spain have some type of chronic disease. According to reports, at least one of every 22 million of these 22 million take some kind of drug. Medical practice is frustrated because of this challenge of chronic diseases. If we do not cure, it means that we do not know what to do. We don't feel well. We become tense and we have anxiety. Today, the medicine we know only tries to cover up symptoms. Patients get more and more information about their problem. Per se, that should be considered to be something good, but from the perspective of the doctors, it's considered to be something dangerous. We have a bureaucratic model, highly bureaucratic model, and we expect to have problems with regard to the economic resources. Technification has replaced the art of medicine. After years of problems, patients that consult and they ask you to solve their problems in a few weeks. That occurs. I'm sure you've all experienced that. Integrative medicine, is it a new medicine? It is Hippocratic medicine adapted to the 21st century. Hippocratic medicine spoke about the natural curative energy. Human being has a mechanisms, fantastic and precise mechanisms, fix megatrix nature. Hippocratic medicine interprets the disease physiologically. Those working in the field of integrative medicine will have to recover their knowledge of biochemistry. You see, those of us that do medical practice will have to have this new approach, this idea of balance of health and disease as an imbalance has to do with phenomena of elimination, dyscrasia. What is impure has to be eliminated. To establish a diagnosis and effective treatment, it is necessary to have an overall vision, an overall view. Overall view requires knowledge of genetics and and the molecules, molecular science, biochemistry, physiology, anatomy, technological diagnosis, the environment, psychology, beliefs. Hippocrates said, for humans, what we have is chronos. We walk through life, we live through life without knowing what is happening, but God has a way of controlling this, the so-called kairos, opportunity, and it's necessary to have a capacity to observe, to act quickly, to be prudent, intelligent, and respectful. So, we have a medical approach that attempts to restore health. Restoring health does not always mean cure. The Institute of Medicine in the United States in 2001 established the new rules. Healthcare should be based on continuous relationship with the patient and not a simple medical consultation or appointment. And this is based on values and needs of the patients. The patient is the source of control. And this is a real problem today. The concept of empowerment of the patient, it's very difficult to understand from the perspective of Spanish culture. This is a source of tension, but at the same time, it is a source of opportunities for those of us who accept this new approach, this new concept. Knowledge and decision making should be based on evidence. Knowledge should be shared. Safety ranks first before instituting any type of treatment. We should anticipate situations. We should reduce expenses, not costs. Costs has to do with management. Yes, because we have to reach the end of the month. Reducing costs does not mean reducing expenses does not mean reducing costs or vice versa. And doctors are not the center of the world. We were taught that we were up there and we look down, look at them down there, they're small as ants. But things are changing now. We have to work and learn to work in a multidisciplinary team. And that's not easy to do. Patient empowerment, that is key in integrative medicine. But we have problems, but because we're going to switch from a paternalistic culture to a participative culture. Internet has changed everything. We are now in a new model. It's not only a source of new information, but it is also a social network in the 2.0 network. We have patients. I have from time to time, I access the forum of these social networks and I learn. We are now reaching the point of collective intelligence. It says, don't look for the expert, ask the community. Don't turn to the expert, ask the community. Patient opinions, that's an interesting web page. Patients start to present ideas. Who's listening to your stories? 30.29% stories total. In Spain, there are projects. The School of Patients has received recently an award from the National Health Care System in Andalusia. So these are all phenomena where patients interfere, where patients participate and get control of. Patient speaks. We should listen to the patient. And the professionals, what do we do to avoid becoming mad? We should try to channel information so that they will not be out of control. But we cannot put a fence in the open fields. Those fences won't work. We need new approaches. We need new results. We need to have this encounter with the patients. And sometimes we have to control our way of intervening. And let's remember that patients exchange their information. The Vivosano Foundation also develops this type of project. It mentions empowering the patients, but that also entails making each individual and patient also responsible. In 1993, the situation in the United States, evidently they have very, very interesting qualities. Firstly, they are very pragmatic, and that's the reason why they stand out worldwide. So as I was saying, in 1993, in the United States, an Office for Alternative Medicine was established, was founded within the NIH. This is the consortium of academic health centers for integrative medicine in the United States. They prepare programs, integrative medicine programs. Observe the definition. Integrative medicine is the practice of medicine that reaffirms the importance of the relationship between practitioner and patient, etc. This is comprised of these 47 universities. Some of them, this one for instance, is very highly prestigious, and they already have their own postgraduate programs for doctors and other health professionals. The consortium has been created to develop programs and guidelines. I would like to invite you to access this web page, the Arizona Center, University of Arizona. Whale leads this. Or Duke University, Mayo Clinic University. You will see what they're doing. Well, in Europe, we always act late, but that's part of our culture. In Europe, here is the forthcoming meeting for integrative medicine, which will be held in Berlin in October. I think the next one will be held in Florence. Yes, last year the weather was really very bad in Berlin. I hope this year it will be better. The Royal London Hospital has changed its name. Royal London Hospital is now called for Integrated Medicine, and the Charité Hospital in Berlin, a very prestigious hospital, its social department is supporting this type of initiative. The Royal London Hospital for Integrated Medicine. Look at the pictures. Here are the contents, the list of services provided. They have integrated medicine, but integrative medicine that is more focused on certain aspects. For instance, you can see the list of activities here. I'll indicate just a few. Here, for instance, there is a continuous mention of complementary cancer care. But they also continue with their policy on homeopathy. Some say that there are also services for rare diseases or for syndromes that have not been resolved by medicine, conventional medicine, like the fibromyalgia syndrome service. This society, SIO, Society for Integrative Oncology, this society was established in the United States and is providing new and interesting ideas, new guidelines, new actions are purported, new security approaches are put forward, and this is a field that is really very difficult for obvious reasons. Professionals need support from national and international organizations, and also they need guidelines, therapeutic practice guidelines. As Natalia said, we can achieve integrative medicine and do this with two approaches. You have the low profile, where we use allopathic. There's an allopathic prevalence, where you have soft, so to speak, alternative medicine with nutrition, therapeutic exercise, yoga, hypnosis, etc. And it's much more difficult to do the hard type with a prevalence of the alternative. Perhaps this term is not correct. Rejection or less importance paid to drugs. But here we have the orthomolecular aspects, nutritional therapy, intravenous therapies, immunomodulation, microimmunotherapy, and others, phytotherapy, cellular therapy, and the use of hormone precursors. Publications are important, and there are already so many. This is a journal. This is the European Journal of Integrative Medicine. This is a Chinese journal, and we begin to have more and more journals. This is a Chinese Journal of Integrative Medicine, and the peer review of these journals are not biased. In science, there are two problems. One has to do with dogma or beliefs. That's a big problem. And the problem of prejudice or bias. This is our web page. We're just starting in the field of integrative medicine. We are not yet doing 100% integrative medicine. We're just going through the process. We have a legal framework. We have a social context. Patients in Spain and in other countries also have their cultural prejudices and bias. When I'm asked, well, and shall I tell my doctor that I'm taking this? I say yes, and the sooner the better, so that your doctor will know you're taking that. And later ask, what did he say? Well, he just laughed and said, or he said that he didn't understand anything. So you can see this situation, this context is important to bear in mind, and one has to be continually demonstrating that our approach is correct because we're controlling the symptoms. So we're forced to validate our competence continually. Our School of Integrative Medicine also wants to support this type of projects. It's not easy to conduct research work in the field of integrative medicine because of the many limitations that exist. Sometimes, because integrative medicine treatments form part of a program or that are standardized program. Another problem has to do with methodology. Integrative medicine requires individualized treatment vis-a-vis standard approach using protocols. In integrative medicine, each intervention represents more than one type of procedure. So solutions are being sought. Can you tell me how we can possibly evaluate two programs, two different sessions of relaxation and its impact on heart rate and cardiac output? Acupuncture, these different approaches leads us to create a new model, a new epidemiological model to be able to study this type of medicine. That's very difficult to do, easier said than done. Integrative medicine has a mix of specific and non-specific elements that cannot be separated. I think we shouldn't be speaking about the placebo effect. I think it's better to try to determine what placebo effect means. In all therapeutic action, we've seen that there are definitive elements, incidental elements, or context and preliminary elements. The model allows us, in phytotherapy, allows us to give a patient information using phytotherapy, and the patient accepts it. And another group of patients that receives phytotherapy but really receives a placebo, another patient that's informed that the product is given but the patient does not receive it, and another one is not informed and does not receive it. So connections are established. A and B will determine the psychological effects with the produced by administration of the product or effects due to expectation. C and D assesses the pharmacological action. This focuses on expectation. Medicinal plants, also this type of research work has to do with other problems such as the synergistic effect. What do I do? What do I assess? Do I assess the root of that plant? Do I assess the flower? Do I assess the harm produced? In the conventional approach, it's easier to focus on the main active component. And then also with the problem of appropriate control. It has to be evidence-based. It's not easy to have adequate control groups. Recently, in the Madrid campus, we got complaints. We got complaints because the animals of the laboratory were undergoing stress because the university students were celebrating and were celebrating and were making noise and had affected the results of the trials, the experiments, because the animals were getting nervous. Many therapeutic modalities in complementary medicine does not permit using a double-blind study. Some have developed this idea of a modified double-blind study. That's a reference down there. Now, who provides a treatment in a study? Many studies in complementary medicine, for instance, the bioenergetic medicine depends largely on the health provider. A nurse told me, the patient did not tell me, a patient told me that a patient with cancer who comes to this, a healer from London, a healer from London comes every 15 days to treat her. And I think that that healer was in jail for reasons we know. We have these virtuoso groups, as a colleague said before. That's not practical. That's an exceptional person, just like a child with perfect hearing. That's a quality, an innate quality, an inborn quality. But that can't be used in day-to-day practice, the virtuoso, and then we have the charlatans, and we have more of these charlatans of quacks. Many treatments may be potentially valid and are affected by the reputation of the quacks. In here, a meeting on chronic fatigue syndrome, CFS, we had an example of this. A doctor said that his wife was almost died and was so desperate and found a machine that was being sold and advertised in a well-known magazine. And the wife was a nurse. She was dying. He applied this machine, and she improved, she improved, she improved, and now she's not here. She's working in the emergency department and said that I don't understand anything. And the panel said, well, one has to be very careful with what one buys on internet. I think the analysis, the approach should have been the following. I don't understand, just like you, I don't understand what has happened, but let me know what the equipment is, what its name is, and I'm going to get this information instead of rejecting his comments as if he was a fool, he were a fool. So very often, when we take this approach this um, and apply this consideration to everyone, we might also lose opportunities for advancement. The randomized clinical trials very often have a short period, and these studies are costly, and it is not easy to find this type of medicine. The absence of patents and funding. Very often we've seen that men's procedures and those detox, homeopathy has a period of symptom exacerbation that might require prolonging the study period. This echo focus, this echo project, might be an alternative in analysis, in regard to analysis, and might help us solve this problem.
Es un juego.
Very quickly now. I can fill up the screen and add more.
¿Ya? Sí. Hay más.
I can add more. But can we know everything about what we have here right now? I must admit I can't. Therefore, when we do integrative medicine, it's necessary to be familiar with techniques and to use these techniques correctly. But that leads us to another problem, because sometimes other colleagues focus a study of this type with different techniques. That also makes it more difficult to do comparative studies. In our center, we want different people to form our team and to be specialized. One, more knowledge or more background in homeotoxicology, others in cardiac coherence, etc., etc. And otherwise, if that we don't use that approach, then we will not be able to cope with that situation. Last week, I was at a meeting in Valencia. My aim is not to speak about the results of Hashimoto's thyroiditis. I only wanted to point out, with this case, the difference in approach. A 38-year-old female with a diagnosis of Hashimoto's thyroiditis who was undergoing treatment with 75 microgram of Uterox. And the patient consulted, we did studies, we identified the patient's could not tolerate lactose, had subclinical adrenal insufficiency, and had DHEA and progesterone deficit, and also enzyme was deficient also. Data on her TSH values, anti-TPO, and T4 values. This analysis was being done in the laboratory. As you all know, different techniques can give us different values. That's a patient scan. Subthyroid lateral view, you can see small cysts here. AP view, here you can see skin, larynx, and two lobes here. You can see this structure that is slightly grainy. The cysts were bigger, and our team went from one side to the other and had limited the use of these scans. Well, sometimes that occurs. We gave her, we used a diet for her intestinal dysbiosis, glutamine, lysine, arginine, omega-3. We used Q10 and microimmunotherapy. Unfortunately, we only use a microimmunotherapy. And we continue giving her Euthyrox, and we had to give that in decreasing doses. TSH showed these values, anti-TPO values started to drop. These are the values for February 2008 and May 2011. She was not given Euthyrox, no more supplementation. In Valencia, I presented this data and I asked my colleagues, do you understand anything here? Can you understand this? Is this patient cured? The patient has no symptoms. The patient's not taking Euthyrox. The patient's values are normal, are within normal ranges. What's happening? So that's what I asked them. I said I couldn't understand that result. So what's important is that when we treat a patient with intestinal dysbiosis, intestinal wall, intestinal lumen, mucosa, immune system, and patient with Hashimoto thyroiditis, because this is also a frequent association, the anti-thyroid antibodies improved with that type of treatment. So she had pharmacological hyperparathyroidism, and we had to reduce the levels of Euthyrox. The patient said, I have tachycardia, I'm sweating a great deal, I'm very nervous. So we thought, what's happening? And we decided to reduce the levels of Euthyrox. So we started reducing the Euthyrox dose, and little by little we saw the patient improved. So we believe that Hashimoto thyroiditis might not only might have to do with the membrane disruption. These membranes are prolonged. They're not localized. And thyroid, well, it affects also the endoderm. Hashimoto thyroidism is more prevalent in women, much more. Why? Because it is much more highly associated with other immune phenomena, TSH, FSH, chorionic, GTH is also different.
Sé que el tiempo avanza. Otro caso.
Another recent case, which has to do with hyperallergy. 67-year-old female, retired. She worked in a shop and currently attends to her grandchildren. She's married. She has lost 15 kilograms in the last year. She was assessed following normal traditional protocols, and she was diagnosed as having allergic angioedema at a very important center. Yes, I studied in Madrid, and she was assessed properly. Everything was done. Complete workup. She had showed deficit of 25D3, retinol, the rest were normal, no anemia. Everything was negative. Skin tests, skin challenge tests were negative, but she said that she couldn't eat anything. And when she took something, she had these pains in her mouth.
Todo empezó después de que tuvo un diagnóstico de alergia.
She had this very, very strong heartburn, and I think this also will happen to me sooner or later because I like to eat raw fish. And she could only eat ecological food, natural food, beans that were sent by relatives who planted these food. Assessment showed BMI 18.55, We did a Medtronic bioresonance study. This is a procedure. It's not well known, unfortunately. Perhaps one of the groups have seen a greater number of patients using bioresonance. And I was 2 years. That was explained to me 2 years before, and I wasn't interested in it. But little by little, I tested the bioresonance of Medtronic. We did different types of studies. We did study using endoscopy, etc., magnetic resonance, and we did the bioresonance. And we found, my colleague will be speaking about this technique, and we can dwell on more details later on during the presentation. We found intestinal dysbiosis, increase of ammonia levels, IgA levels were also increased, and the presence of Candida albicans. She had intolerance to gluten, lactose, fructose, sorbitol. She had vagotonus of the neurovegetative system, of involvement or compromise of the larynx, esophagus, cardias, pylorus, pancreas, atrioventricular fascia, endocardium, uterus, brachial plexus, lumbar and sacral compromise, and had olfactory bulb compromise, and also limbic system and the substantia nigra. You know that in Alzheimer, we already attempt to diagnose Alzheimer early. And in many of the cases, many patients cannot have olfactory disorders. Here's a list of environmental toxins that we detected. I think the vibrations, if the additional vibrations were added, we would be able to have a longer list. She was given antihistamines and vitamin B12, IM. Fortunately, this was our treatment plan. We did that intuitively because integrative medicine is still building itself. Strict nutritional control. Elisa will be speaking about that. And there was a recording of everything that the patient took. And very little by little, we started adding nutrients and also suggested to the patient where she could buy these products. We also give immunological stimulation using label life products. We give other types of stimulation also, such as mushroom concentrates. We also did hepatic detox with live detox and included program of cardiac coherence and melatonin. Integrative medicine has come to remain. It has come to stay. I'm convinced. Dr. Chavert says that, don't worry, every year they change the name. But I think this year it will not change because the Academy will now take charge of that. It is a type of medicine that we should become familiar with. Evidently, that's going to be the medicine of the future. Thank you.